Just a few months ago, Congress implemented the most significant expansion of health benefits and services for toxic exposed veterans in more than 30 years. It's called the PACT Act, and here to tell veterans everything they need to know about it is LaShonda Jackson. LaShonda, let's get right into it. People may not realize that the PACT Act is, or the word PACT is an acronym, so it stands for something. Tell us how this act came about and what it stands for.
The acronym stands for P equals promise, A to address comprehensive toxics acts of 2022. What most people don't realize is it's actually named after our sergeant. His name is Sergeant Heath Robinson. And if you have time, you could Google his name and or go to YouTube. There is an interview with him, with he and his wife, and the interview touched me in a way that I just kept on investigating. The PACT Act was signed on the birthday of his daughter, who was 6 years old when he passed away. So
Yeah.
when I researched him, the PACT Act became so much more than just an act. To put the humanity in with it, to tie that in, makes me work harder and makes me a better employee to serve our veterans in this capacity.
LaShonda, it's great to hear that you as an employee, that you're so excited about serving veterans under the PACT Act. Let's explain a little bit more about what it is.
PACT,
Who does it serve?
okay. So PACT Act are for veterans who were exposed to toxic environments, specifically the burn pit. So PACT Act does include Agent Orange, but specifically the burn pit. So what I'll tell veterans who, and they're not sure if they were exposed, still let's do the questionnaire and let's find out. I won't turn any veteran away, even if they think they were exposed to a toxic entity in the air. We'll still go through the process of having them to have a toxic exposure examination.
LaShonda, I know the VA healthcare system is pretty comprehensive, but this act expands the services that it provides. So tell us more about the expansion.
The law expands healthcare eligibility to several groups of veterans who may not have been eligible before, and requires VA to phase in hospital care, medical services, and nursing home services for any illnesses to the three new categories of veterans. Category one is veterans who participated in toxic exposure risk activity is first category. The second category is veterans who were assigned to a duty station,
Mhm.
including the airspace. And that was quite odd. I said, they were exposed in the air? Yes, Kenya, they were. In category three are veterans who deployed in support of Operation Enduring Freedom, Iraqi Freedom, New Dawn, Inherent Resolve, or Resolute Support Mission. Those
Okay.
veterans. Mhm.
The PACT Act, for what you're saying, it's a law that expands the services that are available to veterans through the healthcare system. So veterans who may have been, so who served in certain areas of the country during certain times or certain war eras may have been exposed to certain toxic substances and have health conditions based on that. And you mentioned screening. So for those veterans who think that they may have been exposed to toxic substances or situations, even as part of their duties in the military, how should they come to the VA? What should they expect?
So when veterans call, and I've been getting a lot of phone calls, wanting to get on the registry for exposure. And there is a website that I have to direct them to. On that website, you will have to answer a questionnaire like, where were you, the frequency and duration of your exposure. And our clinicians here, based upon that questionnaire, will be able to determine what type of burn pit was it. Tires, was it aerosol, was it chemicals, what type, and then you'll be put on the registry. And there's also a 1-800 help desk number that you can call. That help desk will help the veteran through the process of having a sign on to complete the questionnaire. That's the one thing that I can't assist with that most people think I can, but they ask personal questions like, who was your high school teacher, those sort of things, and I can't answer that. But once they fill out the questionnaire, then I can schedule them an appointment for a registry exam.
And so for those veterans who may have been exposed to some of those the burn pits or just other toxic exposures in the area, what benefits are included with this expanded eligibility?
So some veterans are under the assumption that they have to enroll in the VA for the screening. No, you just have to register. And the registration is just so that we can pull your information up and the doctor can put a note in the system. Some veterans prefer to still use their civilian primary care provider, so they do not have to enroll. The enrollment process is free for these veterans. They have 10 years to use their Combat Act, the PACT Act qualifications to receive health care here without
And
co-pays.
right. And for those veterans, we do want the veterans to enroll. They can
Mhm,
still use their community providers or whoever they have for their health insurance. But
mhm.
it's great to enroll in the healthcare system because we have clinicians who are trained to work with veterans who have been
Yes.
exposed to certain things. So we do want the veterans to enroll and to go through that screening process. And then also for the veterans who are enrolled, I understand that they don't have to do anything to get to go through a screening process, that their primary care doctor will work with them. How does that work?
Yes. Oh, I was excited about this. So all new veterans that are enrolling, they're going to get the screening off the bat. And then after every 5 years, they'll continue to do the screening just to see if there's if anything has developed over the years. For First Sergeant First Class Heath Robinson, he started developing symptoms 10 years after he came home. So he was home for 10 years before he started feeling sick and was diagnosed with this weird or different cancer. Hmm.
And I understand the veterans who are already enrolled in the system, as they come for their primary care appointments, will the screening questions be asked during their regular appointments, or should they ask their doctor or at least mention some issues they may be having that could be related, or if they were in an environment where they were exposed to toxins?
Oh, our primary care providers are phenomenal with the asking questions. I'm getting emails more and more recently where our providers have asked those questions, and the veterans will say, "Yes, I'm exposed." At that point, then I walk them through the process of completing the questionnaire so that I can make them an appointment for the open burn pit registry as well as Agent Orange.
Okay. And then you mentioned the enrollment process, that it's pretty simple for those veterans who aren't already in the system. How can they enroll and start taking advantage of this expansion?
Of course, we have our new enrollment department. It's kind of still new. They can come in and they can speak with one of our MSAs there and fill out the enrollment and eligibility form. It takes about 10 or 15 minutes to fill it out. The PACT Act veterans, they will not have to provide any financial information because they are eligible under the PACT Act. But if they do fill out the financial information, it could hire their priority group later on after the 10 years are over.
So the veterans can come in, or can they go online to enroll?
Yes, and they can also call 877-222-8387 or 877-222. I remember it as VETS, VETS, which is 8387.
Great, great.
Mhm.
And then just one last question. We talked about there are, I'm sure, a lot of conditions for those veterans who aren't sure. What are some of the conditions some veterans may be experiencing or may have experienced that they can go, you know what, I did serve, in Vietnam, or I did serve in the area. We did burn tires. What are some of those conditions?
Right off the back, that comes first in my mind is asthma. A lot of them are developing asthma later on in life. I never had asthma growing up as a kid, but when I came home, now I'm diagnosed with asthma, rhinitis, sinusitis. And again, the rare cancers. And the one thing that really surprised me, Kenya, was high blood pressure. I said all my life I thought high blood pressure was hereditary. You got a hand down, something. No, they are actually tying open burn pit to high blood pressure.
That's fantastic. So we want our veterans to know they're employees who work with LaShonda and
Mhm.
throughout the healthcare system who are passionate about this act and giving veterans the services they deserve.
Yes, ma'am.
So thank you so much, LaShonda.
Thank you.
If for those veterans or the people who serve those veterans or care for them, if you want to learn more about the PACT Act, please visit the VA website at www.va.gov/PACT. That's PACT.
I offer therapy to veterans in our residential program, and I'm on the team.
Hi, I'm Mike Richmond of the U.S. Department of Veterans Affairs with information on an important free resource for veterans, the VA Health and Benefits app. The tool is like a one-stop shop for veterans. It allows them to view or cancel VA medical appointments, send and receive messages from healthcare providers, and download VA benefit letters to provide veteran status or disability payments. Veterans can also manage existing VA claims, find the closest VA medical centers, and get quick access to the VA crisis line. You can download the Health and Benefits app on your iPhone or at the Google App Store, or wherever you normally get your mobile apps. If you already use this app, please share your feedback on your phone's app store. That's the VA Health and Benefits mobile app. I'm Mike Richmond.
Are you one of the millions of people who suffer from back pain? You may be surprised to learn that there are lots of therapies that you can manage yourself that don't include medications or extra trips to your doctor's office. One of our very own doctors here at the VA Maryland Healthcare System is developing an app to help you manage and prevent pain, and she's with me today, Dr. Beth Hogans. Dr. Hogans, this app to help people manage and prevent back pain. Tell us more about what's it called, first of all.
So our working title is Ready Go Pain. We also call it the Pain App, just very simple. As it grows and develops in VA, it may acquire a new name, but for now we just call it the Pain App.
What made you come up with an idea for an app?
So I was a medical student here at the Baltimore VA, but when I came back to the VA here in Baltimore 4.5 years ago, a major report had just been published that included data about lots of different kinds of non-pharmacological therapies, including physical activity, mindfulness-based stress reduction, yoga, many different therapies. And when I reached out to the group, I said, do you guys have an app to help get this information into the hands of patients and providers? They said no. And I was like, well, we could work on that. And also, I was aware from being a doctor that there's often not enough time in a clinic appointment to cover all the bases. And I really thought that this would help both veterans and their healthcare providers connect around the potential for incorporating non-pharmacological therapy into a pain treatment plan.
Yeah, and it seems so empowering for the veteran.
That is exactly the point. I mean, I think some people would say, oh no, you can't do that because all therapy has to be prescribed. But I really believe in patient choice and patient opportunities to engage in their own treatment. And after all, the best pain treatment plans really do grow out of a patient's interests and inclinations. So if we're going to be veteran-centered and optimize veteran choice, this app is really designed with that philosophy in mind. We want the information in the hands of veterans, their families, and their caregivers.
Well, let's walk us through it. How does the app work when a veteran, and how does the veteran, when I think of an app, of course, I get it on my phone, I download something, but I think it's a little different with this program. How can the veteran access it? And we'll start there.
So app development for VA is a process that does take some time. So we are partway through that process. Right now, the app is available through our clinical trial. So we are registered on clinicaltrials.gov, like all VA trials. It is a minimal risk trial because it's really about the veteran using the app, which we have on a tablet, and choosing the activities that they would like to engage in. So we are trying to put the evidence in the hands of the veteran. It is right now limited to those veterans that sign up for our research study, but we are going to be expanding app access this year through additional studies. But until we've actually had a chance to show that it works, I think it's going to still be in that research context. But we have met with the app development team for VA, which is based in Palo Alto, and they're very interested in working with us to get the app into app development and get it on the App Store.
All right, so how does it work? If a veteran has the app and they want to go through it to help with back pain, how does that work?
Right. So we in the study, we give them a tablet to use for the 6 weeks that they're with us. They will learn with our study coordinator, who is also trained in health coaching, how to use the app and to set up their own plan. And then every day they can open the tablet, they can look at their plan, do the activities, and then we also provide them with a resource guide, which is primarily based on VA resources, because there are so many VA resources to help support veterans with self-management of chronic pain, but there's no central place to go for them to organize that. And so the app really serves that function of just opening the app, looking at the plan that they themselves have made, and kind of going down the list. It's like we say, plan the work and work the plan. So this
Right.
app is really based on that philosophy.
And for a veteran who has back pain, I mean, it could be really severe. And
Yeah.
you're talking about an app and a plan that they do on their own. It could be kind of scary. Tell us about some of the plans that they can implement on their own in that app that they then can follow on their own.
So we take a very gradual step-by-step approach. So for this study, we do have the veterans agree that we can look at their medical records. So they're screened for general medical conditions, which would make self-directed physical activity, potentially harmful. So, but the app starts with what we call baby steps, right? So we're talking about a 2-minute walk. At the beginning, you can choose to start at that very low level, basically, walking to the mailbox, or just, making an effort to take those 2 minutes of steps every day. And also we start with things like, learn about this therapy, talk to your provider about this therapy. There are VA videos, so watch a VA video about this therapy. And so it really is a self-education process. And it's based on the ideas, like in the book Atomic Habits, where you begin a new lifestyle by taking small steps incrementally and building up to a healthier new life.
And you talk about lifestyle. And what are some of the things that cause the back pain? I'm assuming lifestyle could be one of those things.
Yeah, so like a lot of pain conditions, it's a mix of who the person is, what their biology is, what their life experience has been, as well as all the accumulated other things that they have in their life, whether it's stressors or whether it's medical or mental health, what we call comorbidity. So if you have hypertension, obesity, diabetes, those things are going to impact whether or not you have back pain. Nonetheless, everybody can engage in some level of pain self-management, regardless of their existing comorbidities. We're currently working with the mental health team to try out the app in patients with severe mental illness, because we know that certain kinds of mental health challenges and problems go along with back pain, whether it's depression and anxiety or substance use disorder. We want the app to be able to help everyone.
And before we wrap up, can you tell us how beneficial the app has been so far?
We are finding that the app is really helpful to veterans who have otherwise felt lost in the system. So that we're really excited to see that we have veterans that were frustrated and felt like there was no way forward. And all of a sudden, they're using the app every day and they feel really positive about making lifestyle changes to take control of their own pain.
That's fantastic. So for our veterans who are hearing this and are as excited as I am to hear about it, how can they learn more to get into this program, to use the app?
So we would love to hear from them. They can reach out to our study coordinator by the telephone number that's available, or by email. And if someone has questions, they're certainly welcome to contact me as well.
I choose VA for healthcare because the VA, they understand veterans.
I heard about the VA from some friends, so I decided to check it out for myself, and I'm actually glad I did.
And VA provides services with veterans in mind.
I also have private health insurance, and I can see any doctor I want. But as a veteran, I like the care that I receive at the VA.
I'm a veteran.
And I choose VA.
I offer therapies to help veterans deal with their stress, and I'm on the team.
You know, when I came back from Vietnam, and with all the veterans I knew, most of us knew nothing about the term PTSD. 10 years ago, I came into the VA and I got a mental health evaluation. I started getting counseling in group therapy and individual therapy. My advice to a veteran is don't wait until you're totally in crisis. Go into the VA, seek the assistance of those who can help you, just like they helped me. I'm a veteran. I choose VA. I choose VA.
I'm a nurse here at the VA Lock Raven Outpatient Clinic. I am here to help you set and achieve your healthcare goals. I am on the team.
For anyone struggling with mental health and those who love them, access to life-saving services is just 3 numbers away. Now you only have to dial or text 988 to reach help through the Suicide and Crisis Lifeline. Our suicide prevention coordinator is here to talk about these exciting new developments. Nicole, 988, why changing to a new number?
Well, the thing about 988, it makes it so easy for people to reach out. And what I love about 988 also is it correlates it to a medical emergency. So when we think of 911, that means we need help immediately, we need support. And so 988 is the equivalent in mental health. And so I love that it makes it easier for anyone, because anyone can use 988. But our veterans can then press 1, just like they did for the Veterans Crisis Line. They just press 988, and then when the prompt comes on, identify themselves as a veteran by pressing 1.
That is fantastic. It's a great perspective, just those 3 numbers, because when you are in crisis and you need help, the last thing you need to do is remember 7 numbers. So for those who aren't aware, what can someone expect on the Veterans Crisis Line, and even for veterans and family members or those who love them?
Family members do call all the time. The other thing I wanted to make sure to say is that it's not always about the family member making sure to connect the veteran. Sometimes it's about the family member just getting some support of what they can do to help, because maybe that veteran's not willing, because they really provide a lot of different help. You know, the person might say, well, my loved one doesn't want to, I don't want them to know I called, but what can I do? And sometimes that feedback can be very helpful. Sometimes they are fearful that as soon as they say someone they love is suicidal, that the sirens will come to their home. And that can be a very scary thing. And so to be able to say, no, I don't want anyone to call him, but can you give me some advice on how I can encourage him? And there'll be resources that they can provide and everything. So what happens is when they call, there's someone there 24/7 to answer that call. They will assess the situation, identify if it is an emergent issue, and the VA has connections with local jurisdictions across the country. So for instance, in our area, if a veteran in this area or a family member calls and they have an emergent issue, the Veterans Crisis Line can then reach out to the local jurisdiction to provide compassionate care for that veteran and family members. And we do training across our region to ensure that police departments know what the risk factors our veterans have and how to really have a compassionate interaction with the veteran or the family member in order to get that veteran to help. And so, yes, they're able to identify that veteran. If we can identify that veteran's location, they can find them and get them to support immediately.
What about a veteran who may be suffering from a substance abuse crisis? Is 988 still the appropriate number to call?
It can be an awesome resource. It can be the first point of contact for a veteran who wants to get into some services. And so reaching out by 988, talking about what's going on and identifying resources in their area that can be supportive, whether it be an outpatient program, a residential program, or even coming into the hospital if they need emergent withdrawal support. So yes, it can be an awesome resource for veterans or loved ones that need that kind of support as well.
It sounds like the line is staffed with professionals who have a wide variety of backgrounds. Can you tell us more about the people who are on the other end receiving those calls?
Sure, they're all licensed independent providers, sometimes social workers, psychologists, psychiatrists, from a variety of different disciplines. But our goal is to make sure the veteran feels supported, that they're safe, and that aftercare is available. You know, that's one of the biggest things. In that moment, we can meet the need and give them hope. But the biggest issue is making sure that they get connected to a VA facility. And maybe they are connected medically, but our goal now that we have identified this new issue, this new concern, we want to make sure that they're seen in mental health so that we can, bring recovery to their lives so they can live to their fullest.
Absolutely. With the change in the number, does the old number still work? The 1-800-273? Okay.
For veterans I always encourage veterans to put the number in their phone. So those that have it in their phone can still use it. That number will still work. You can also still use the text number, which is, and I want to make sure I give it, they can use text number is 838-255. And they can also still chat on the online services, which is the www.veteranscrisisline.net. So yes, all of those resources still work. 988 is just a way to make it so much easier. And if it's emergent, to make it quicker for recovery.
And this is a national change, correct?
This is a national change. It was signed into law in July of 2020 and implemented nationally in July of 2022.
Have you noticed an increase in calls since the new number?
Yes, we have locally and nationally, they recognize that there is an increase of calls to the Veterans Crisis Line and across the board to hotlines, the local ones that may answer the call for non-veterans. So the great thing is that more lives are being saved by this change, which I think is amazing.
I think so too. Nicole, you and your team do such a fantastic job providing those services and reaching out to our veterans. So we're so happy to hear that there's something that's even easier for them to access the services they need with the 988 number.
Yeah, and I'll just add that it's never easy to ask for help, but I love that this makes it a little bit easier.
Right.
But our hope is that across the board, people will understand that mental health challenges are real and there's help available, and it's okay to ask for that help.
Absolutely. Thank you again, Nicole, for everything you're doing for our veterans. And I hope they remember 988, put it in your phone. For if you love a veteran, if you know a veteran, put that in your phone and always have it available. We have people here to help 24/7.
Remembering everything you need to do after your VA appointment can be overwhelming. That's why the VA has developed a new tool to help you keep track. Meet Annie. Annie is an automated messaging app that uses instructions from your doctor to help you stick to your personalized care plan between appointments. Annie sends reminders and other helpful messages directly to your phone or other devices. Respond to Annie with a simple text or through the Annie app. Your responses are available for you and your VA care team to review at any time to track your health goals, encouraging you to take an active role in managing your health.
This wraps up this edition of Veterans Health Watch. If you are a veteran, apply for VA healthcare today. You deserve it. Just visit our webpage for more information.